The next presenter, please. The comparison of retinal microcirculation in healthy and amblyopic children using OCTA. Dr. Tisha Thomas.
Good evening all, myself Dr. Tisha Thomas. So here I am presenting comparison of retinal microvasculature in amblyopic and healthy fellow eyes of children using OCTA. So we know what is amblyopia. It is a unilateral or bilateral reduction in best corrected visual acuity during the years of visual development secondary to abnormal visual stimulation. It is also defined as difference of two or more Snellen or logMAR lines between the eyes. And this is one of the most common cause of monocular vision loss in children. And with the advent of OCTA, which is a non-invasive imaging modality, it permits visualization of the microvasculature of the retina throughout its depth. The aim of my study was to compare the OCTA findings of retinal microvasculature in an isometropic amblyopic eye with healthy fellow eyes. Primary objective was to quantify the changes in vessel density in an isometropic amblyopic eye and fellow eye, and my secondary objectives were to compare and find out the possible association of retinal microvasculature and amblyopia and to correlate the severity and type of amblyopia with vessel density values. So we included children between the age 5 to 15 years and newly diagnosed cases of unilateral and isometropic amblyopes, and we excluded children who are less than 5 years and more than 15 years who are already on treatment on anisometropic amblyopia and any other causes for amblyopia, any other previous ocular surgeries, media opacities like cataract, any other diseases, and uncooperative patients were excluded from our study. So the study participants were children presenting to our OPD department and newly diagnosed cases. And after taking an informed consent form and child assent form, we studied the uncorrected visual acuity as well as best corrected visual acuity, followed by anterior segment examination, fundus examination, and patient according to our inclusion criteria were taken up for the OCTA imaging. So we did angiography scan slabs for 3 into 3 and 6 into 6 mm, and the interpretations were compared with fellow eyes. We studied superficial capillary plexus density as well as deep capillary plexus density using MATLAB software, and we divided the areas into fovea and parafoveal region, and parafoveal was again divided into superior, inferior, nasal and temporal quadrants. Coming to the foveal avascular zone parameters, we studied the area, perimeter and as well as the acircularity index. Also for the central macular thickness, we studied the macular cube scan as well. So this was my statistical data analysis. Coming to my results. So we found there is a significant difference in the logMAR BCVA, whereas there was an equal representation of female and male gender and equal involvement of right and left eye. And in our study, the severity, we had more of moderate amblyopes followed by mild and followed by severe. And type of refractive error, we had more of myopes, astigmatic and then hypermetropes. So according to our study in OCTA parameters, coming to the central macular thickness, we didn't find any significant difference between the both groups. And coming to the foveal avascular zone parameters, we didn't find any change in area and perimeter, whereas we found there is a significant difference in the acircularity index. We found there is an increase in acircularity index in amblyoptic eye group when compared to the fellow eye group. Coming to the superficial plexus density, we found there is a significant difference, that is, there is a decrease in the amblyoptic eye group when compared to the fellow eye group, and a similar picture was seen in deep plexus vessel density as well. And we found there is a negative correlation between logMAR BCVA and superficial vessel density and deep vessel density. Coming to my discussion part, so regarding the FAZ zone parameters, we found only acircularity index was found to be increased, whereas in some other studies like by Dogusi et al, they found there is no change in any of the parameters. And in the study by Tingrao and Sobral et al, they found there is expansion of area and perimeter of amblyoptic eyes. So this can be due to the difference in the instruments they have used. We use Swepso's OCT. So here they have used these Cyrus OCTs. So this can be attributed to the difference in the findings. Coming to the central macular thickness, we found there was no significant difference, but the same picture was also seen by Tingrao et al, whereas it was found to be increased in other studies. So this can be due to the difference in the age, sex and type of amblyopia of the study participants. In our study, we found that there is decrease in the SCP and DCP vessel density. A similar picture was also found in other studies. So I would like to conclude by saying an isometropic ambulyopic eye as compared to healthy fellow eye, there is a decrease in superficial and deep vessel density values, which indicate a possible association between retinal microcirculation and amblyopia. Quantitative analysis of retinal microcirculation in ambulyopic eye using OCTA can be used as a reliable indicator of retinal circulation integrity. These are my references. Thank you.
Very good, very good presentation. Just two
Thank you.
questions regarding the foveal FAZ and the macular cube scan.
Yes, ma'am.
You say both the superficial and deep vessels are important. Second thing is, in cube scan, you told that the thickness was insignificant in your study,
Yes,
whereas most of the studies which we have read, they have a difference in the
Change.
thickness of the macular
Correct, ma'am.
foveal area. So this is very important. If the fovea is thicker, then your amblyopic therapies, which are recent therapies, they are not that effective. That's why we are always supposed to do a scan and an OCTA scan, so that we know whether our patient is going to respond or not. Suppose we have charted the patient and we have not done the OCT. We don't know the macular thickness. We don't know. We are just going ahead with the parameters which are on the case paper. So what is important is the thickness, because if it is thicker than a certain amount, then you can't go with the therapy. It is not going to help you out. Okay?
Yes, ma'am. Got it.
Thank you.
Yes. Did you
Yes.
also grade the severity of amblyopia
Yeah,
with the
yes.
size of the foveal vascular
No,
vascularity
sir.
index?
We followed the rule of like 6 by 18, 6 by 36. Like
Okay.
we classified according to that, sir.
And was it a progressive thing that
So,
you checked the patient who
so
got
we didn't
treatment?
find any correlation between the severity and the vessel density values. There was no significant correlation between the vessel density and the type of severity of the amblyopia.
So do you think the amblyopia is the cause because of the avascular retina, or
yes.
is it the other way around?
Sir, this is a question of debate, sir, but I think we are conducting a study actually post-treatment and pre-treatment. So maybe if the retina is the primary pathology, then even after treatment, there won't be much change. So we can say that it is the retina is the primary source of pathology. If it is otherwise, we can say the amblyopia is causing the decrease in the circulation. So I think that needs a long-term studies.
And what about the choriocapillaris and the choroidal?
We didn't study the choriocapillary density values.
Okay, thank you.
Thank you,
So
sir.
in conclusion, we should say like both the things go hand in hand. Both the things are supposed to be checked. And amblyopia patient comes, you are supposed to investigate the retina also, so that you can comment in future whether you are going to increase the amblyopic vision or not. Okay.